TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Welcome, Vivi. We're so excited to meet you and have a conversation today about the work that you're doing and why you're here at the TNT Fellowships and all of that good stuff. Thanks so much for taking the time to be here and speak with me today.
Thank you so much for having me here. It's such an honor for this opportunity to speak here about behavioral health. It's such an important topic that I know it's a lot overlooked, but yeah, I'm happy to have this opportunity to be here.
Yeah, and where are you from? Where are you working currently?
I am working at Wynn Medical Center here. It's a primary care clinic at in Rosemead.
In where?
Rosemead in
In what?
San Gabriel Valley area.
Okay.
Yeah, we mainly see the Vietnamese population.
Okay,
Yeah,
wonderful. Great.
yeah.
And what is your role?
So I'm a clinical pharmacist at Wynn Medical Center. So my role is I have direct patient interaction, patient care, and I collaborate with our attending physician to provide yeah, patient care and manage patients' health conditions.
Okay. So what does that look like? You're in the role of pharmacy and medication.
Pharmacy, right, but I am also working under a collaborative practice agreement with our
Oh.
attending. So I'm not only like a clinical pharmacist, but I'm currently doing a fellowship in primary care, which means that I'm trying to get my advanced pharmacist practitioner license to be able to do a lot of stuff that the physicians usually do. For example, like I can initiate and modify medication treatments as well. Yeah.
Wonderful.
Yeah.
And how long have you been doing that for?
I've been doing so I did residency and now my fellowship at Wynn Medical Center. So I started in 2023. And yeah.
Why did you we want to know a little bit more about you before
Okay.
we
Yeah.
dive into the
Yeah.
the solutions and all that good stuff that you may be able to share with us. But why did you decide to dedicate your career to healthcare and helping other people?
Yeah. It actually started out when I was very little. So a little bit background about myself. I grew up in Germany. My mom raised me up single-handedly, so
Mm.
she had like that language barrier. So I was the one growing up bilingual in German and Vietnamese. I was
Oh.
the one I was accompanying her to like doctor's appointments, like being that translator, being the mediator between healthcare and a patient who has like
Mm.
language barrier. So somehow it growing up, it just became like a calling for me, a responsibility for me to help patients who experience like language barriers.
Hmm.
So yeah, that's why I wanted to become a pharmacist
Wow.
and help like specifically the Vietnamese community.
So are you
Yeah.
then the translator too in that role?
Right.
Wow.
Yeah, I took care of my mom's health, my mom's medications, and I really enjoyed that. So that's how I became a pharmacist.
Yeah.
And yeah, to be honest, also growing up, seeing how my mom, you know, handled a lot of stress and emotions on her own. And when I was little, I remember when I see her like feeling sad about something, I came to her and I asked her, "Mom, are you okay?" And she keeps saying like, "Oh, she is fine." Or
Mm.
when she went to the doctor, if when the doctor asked her if she's okay, she always says she's fine. So growing up,
Mm.
I thought it would be like normal to, like to deal with your emotions in private. So I thought
Mm.
that, like emotions should not be shared openly. But growing up in the Western culture, like in Germany and now moving to the US, I realized that the Western culture was a lot more open to like discussing about mental health.
Mhm.
And so that's how I wanted to become that pharmacist who
Mhm.
is the bridge between like the Vietnamese tradition and, like mental health. And
Wow.
when I actually did my residency at Wynn Medical Center, my attending physician, Dr. Wynn Tran, asked me that one question that kind of like changed my life, He was like, "Vivi, have you ever considered to become like a psychiatric pharmacist. He was
Mm.
like, you are really compassionate, you are really great with patients, and you have that diplomatic trait. Like, you should think about it, you know? And I was like, oh my God, yeah, I would love that. I would love to help
Mhm.
people, you know? So,
Okay.
yeah, and now I'm here,
Wow.
taking it step by step. Still trying to finish my fellowship now, and then after that, I'm planning to do another fellowship with UCI, the primary care, the
Mhm.
no psychiatry fellowship, and then yeah,
Yeah. So what does your mom think about your career?
she's very proud of me.
I bet she
Yeah, she
is.
is.
Does she know that she's the inspiration in many ways?
I don't think so. I don't know if I ever told her, but she's proud of me for
That's
whatever
sweet.
I do. Yeah.
Yeah, wonderful. So, yeah, you're in an interesting role and you're kind of sounds like just getting started.
Yeah,
And so
right. Very fresh.
why did you decide to come to the TNT program for addiction medicine?
Yeah. So at Wynn Medical Center, we are we will create a substance control committee,
Oh,
and the attending physician wants me to be also chair and the pharmacy director.
oh wow.
So in order to know more about substance control, yeah, signed up for this fellowship.
Yeah, and
Yeah, the
you're
first out of two. I'm still planning to do the next fellowship with UCI as well.
oh
So
good.
yeah,
So you're gonna stick around for a
yeah, it's for
while.
another year.
Yeah,
Yeah.
wonderful. So what what is your knowledge base now about pharmacy as it relates to mental health and substance use?
Right now, to be honest, not too much. Just whatever I know from school. That's why I'm, yeah, that's why I'm doing this
That's why
fellowship to
you're here.
expand my knowledge. Yeah,
Yeah.
and do the things right because I will be on that committee. So I do want to make an impact.
Yeah.
Yeah.
And are you training people now or you're planning to
Yes, I
train?
am training the current residents so under me. So we right now we have two pharmacy residency programs, one with Western University and one with USC. There are two pharmacy residents that yeah, I am supervising right now and I am training them.
And what
Yeah.
kind of things are they being trained on for
On
mental
like
health?
how to take history, how to counsel correctly
Okay.
on medications, how to uh, like notice interactions between medications and all that. Like we take it one step at a time first, and then
Mhm.
yeah.
Yeah, so it's not all just the knowledge of the medication. It sounds like it's knowledge of the
Right.
person.
Yeah, exactly. The whole person in general. Like we don't treat the symptom. We treat the patient as a whole. Yeah. We don't only look at the medications, but we look at all their overall health. Yeah.
Yeah. So tell me, like, what are some of the common conditions that you see at the place that you work?
Yes. So besides from chronic chronic conditions like hypertension, like diabetes, high cholesterol, I do see a lot of patients who suffer from like mental health issues, or at least some type of emotional distress. But a lot of patients, they might not even be aware that they have some form of emotional distress because when they come to our clinic, they come for all different kind of reasons that you can imagine, but mental health issues. Because I just think it has something to do with the Vietnamese culture. It's
Mm,
something that we actually don't talk about. There is
mm,
like that huge stigma around mental health. Um, so yeah, that's why when I see these patients, and knowing coming from like a Vietnamese background myself, I do try to, like ask certain questions. When I come in, for example, for like difficulty sleeping, I try to dig deeper. I try to find a reason why they are not able to sleep, you know. And sometimes, when I ask further questions like, with whom are you living with? That's when they
mhm.
start to break down. That's when the
Oh,
walls start to come down. That's when they tell me that, Oh yeah, my husband passed away. I live by myself. My children don't really have time for me. They have their own family.
Oh,
So
man.
yeah.
Yeah, so you kinda need to start with a question like that.
Right,
Yeah.
right. Because they come in for different conditions. But
Mhm.
then we have integrated like mental health screenings in them. We have a template, but we don't really follow those questions.
Oh,
No
okay.
one's going to go through each single question. But simple questions like, how was your appetite lately? Can you sleep?
Mhm.
How are you feeling emotionally? It's
Mhm.
just by asking those simple questions, it really like opens doors to further
Yeah.
conversations,
Yeah.
Yeah.
Are they surprised by those questions
No,
sometimes? No?
because
Okay.
we've been doing it for
Okay.
quite a while, so it is
Okay. It's part of it.
something part of it. It's normal
Yeah.
to them now. It's part of a physical assessment for them.
That's
Yeah. And
great.
they know that they can openly talk about it because we just integrate it into like a normal conversation. Yeah. It's
Yeah.
not like, okay, tell me about, yeah, it's just a simple conversation. Yeah.
Yeah, yeah, that's wonderful.
Yeah.
And then are you having those conversations kind of one-on-one, or are you there with the
Yes.
doctor
No,
to
no, no,
set
no.
one-on-one?
I see the patients independently, and after that, I present the patient to the doctor and tell them, okay, this is
Wow.
patient case. These are my suggestions. These are my treatment options, and then he agrees, not agrees. Yeah, but I completely see the patients by myself and come up with my own treatment plan.
Wow, that's
Yeah,
incredible.
yeah,
Because I've been hearing about this collaborative
yeah.
approach,
Yes, yes.
but I haven't actually met anybody that was
Yes.
doing it. That's really
Yeah,
cool.
it's very new. It's yeah.
Yeah, yeah. So how long do you get to speak with people in these meetings?
It really depends on their condition.
Okay.
Like some patients who just come in for like a cough, only takes a few minutes.
Yeah.
But some patients who have like more complex conditions, or especially I notice patients with, like mental health conditions, I do spend more time with them. So I'm actually very lucky that I don't have to, meet certain numbers.
That's
The doctor
awesome.
is,
Yeah.
yeah, very supportive. He keeps telling me, I want you to take your time to get to know the patient well.
Yeah.
Like I can, of course, I'm not going to spend an hour, but
Yeah.
I would say on average, I see about like 20 patients per day.
Oh, wow.
Yeah,
Yeah.
and out of these 20 patients, I would say 3 to 4 patients do have some type of emotional distress. Yeah,
Wow. Yeah.
so
So
it's
you're
quite a
seeing
lot
that
every
every
day.
day.
Every day, yes.
Wow.
Yeah.
Yeah. And then did you get specialized training on this type of, interviewing that you're doing?
Yeah, so at the beginning of my residency, I shadowed the doctor.
Okay.
Yeah, so whatever he's doing, I was just like following with my notepad and pen. I just wrote everything down. And then slowly he let me see one patient, one new patient, and then slowly he let me see more patient. And then it depends on like how comfortable he felt like with me. Because
Mm-hmm.
every time I see a patient, I do have to present the whole patient, my plan, assessment, all that. And then now slowly he let me see patients more independently, or if I see if patients come in just for blood test review, and then I can adjust like make small adjustments to the medications.
Mm-hmm.
Yeah, then I see them independently. Yeah.
Yeah. It seems like such a great model to have someone that can go in and
Yeah,
connect on that level
exactly. Yeah.
and know the language. Although I'm sure you're seeing people of all different backgrounds through this practice.
So I would say the majority for um, um, primary care visits is Vietnamese.
Oh, okay.
But so Wynn Medical Clinic, we have it's like 3 specialties in one. We have internal medicine, we have rheumatology and dermatology. Just because our attending physician, he is 3 in 1,
Yeah. Yeah.
So for the rheumatology and dermatology patients, I just screen them, and the majority is non-Vietnamese speaking.
Mm-hmm.
Yeah,
Yeah.
because they get referred to us from everywhere across Los Angeles area.
Oh,
Yeah,
really?
yeah.
They referred to you.
to the
To
doctor. Yeah, to our clinic. Yeah.
Okay. That's great.
Yeah.
So, what are some of the successes that you've seen in your work that make you feel good?
Oh, every day, I have patients coming back to me saying that how much I have helped them.
Mm,
Um, I remember there was like this one lady. She was in her 70s, and also regarding the mental health, she was actually the one that I mentioned earlier that who told me that she felt very lonely. And what we did for her was we asked her to call her daughter in that moment, and she was like, "Oh no, my daughter is at work." And then we were like, "It only takes a few minutes." So we actually talked to her daughter,
oh,
and
wow.
yes, we actually went a step further. We because she told us, "Oh, I never told my daughter, like because she is so busy with her family, I don't want to be a burden." So
Oh,
we actually told her, asked her to call her daughter in that moment, and we talked to the daughter. And the daughter was not even aware that her
yeah,
mom felt that way because there was never a communication.
yeah.
Every time the daughter called the patient, she was, "Oh, I'm fine, don't worry about me."
Oh,
So she was very grateful to us that we brought that up, and that was just like it was very rewarding to like witness that moment when the like the patient lit up and
yeah.
felt like she is actually cared for and loved for as well. So we kind of like initiated the first step. We were like the catalyst of that change.
Wow.
So yeah, and then the next time she came back to me, she was like, oh, she was so grateful. She was like, "Oh, like my daughter calls me more often, and she just visited me last week and all that." And I'm like,
Oh,
yeah, yeah.
wow.
So we just help to like break down that that stigma, that wall between them.
This is so
Yeah, it
interesting.
is. And stories like these are the reason why I really love what I'm doing, Like
Hmm.
we are able to make an impact because we have direct patient care. So we whatever we do, yeah, we can make a big impact on our
Yeah.
patients. Yeah.
Yeah, so I came in here thinking we were talking about pharmacy, which we have been talking about pharmacy, but now you're like,
Yeah,
instead of
because
prescribing something, you're
yes,
picking up the phone and just making that connection.
exactly. Yeah, so we do a lot for our patients,
Yeah,
more
I've
than just,
never heard of that before.
Yeah.
Yeah. Was the daughter surprised
Yeah, she was. She was because she never knew that her mom felt that way.
yeah.
Yeah.
Was she surprised though to get a call from the doctor's
Oh yeah, of
office?
course. She was worried. She was, "Oh yeah, what's
Is
going
it
on?"
okay?
Because like,
Yeah.
"Oh, I'm your mom's daughter," and then her first reaction was she
She's like,
freaked a
"Are she
little
okay?"
bit.
Yeah.
Yes,
Yeah.
yes,
She's like, "She's
yeah. That was funny.
lonely."
Yeah, yes, yeah,
Yeah, yeah.
yeah,
That's really
yeah.
sweet.
It was nice to witness that. Yeah.
Yeah, yeah, very cool. Um, so what do you see for yourself for the future, looking forward into your career?
Yeah. So, as I said, I'm still very new, very fresh in my role. So I will finish my fellowship this summer, and then I'm trying to get my advanced pharmacist practitioner license.
Hmm.
And then after that, I'm still like trying to finish this fellowship, the TNT fellowship, and then trying to get another fellowship in psychiatry. After this, I will be juggling between 2 clinics, so I haven't told you yet, but, at the end of this year by the end of this year, we are planning to open a mental health clinic.
Oh,
So Wynn Medical Center has several different clinics, like, the main location, internal medicine, and then we have 2 pediatric clinics, and we also have a nephrology clinic, so and then now we, opening a dermatology, rheumatology clinic, and by the end of this year, a mental health clinic.
wow.
So I will be part of that mental health clinic as well. So I will be
Yeah.
between primary care and mental health clinic.
Wow, I
Yeah.
can see that you're so happy.
I am excited. It's very exciting because I mean it's like such a groundbreaking step for our Vietnamese community because like there are not a lot of like Vietnamese psychiatrists around this area.
Hmm.
So having that clinic. It
So they'll have a
takes them.
Vietnamese psychiatrist
Yes,
there?
yes,
Oh,
yes.
wow.
I did had patients coming in to me, especially like a young girl. She told me that she was looking for a Vietnamese psychiatrist, a female psychiatrist, for 3 months, and she couldn't find one.
Ah,
In the meantime, we're trying to help her. She knows that she can always come to us, and she specifically wanted a female one, or she was like a young adult. So she knows she can always come to me and talk to me about it.
yeah. So
Yeah.
now that's got to be motivation for you to continue to learn
Right,
more because it's like
exactly.
they literally
Yes,
can't find.
exactly. Yes,
So
exactly.
I better do it.
Yes, I'm on my way there.
I guess it's just me.
Yes.
Tag, I'm it.
Yeah,
Like,
yeah.
yeah,
Yeah.
yeah. Have you been seeing, like, you mentioned, the stigma and kind of the cultural
Yeah,
aspect of just not showing the emotions or not
yeah.
expressing the emotions. Do you find that it's beginning to change or shift at all?
Uh, Very, very slow because like that huge stigma surrounding mental health, it reached back all the way to I'm not even sure for how long, because I know that like back in the days, mental health was like associated with something bad, like people back then believed that if someone suffers from a mental health illness, they were like possessed by some demons, like some supernatural entities, or
Mm-hmm.
they were believed to be punished for what they did in their previous lives or
Mm.
for what their ancestors did in their previous lives. So that was that belief. And somehow that, like that stigma was like passed down from generation to generation. And even like nowadays, there is still like that stigma around it. Like people still think that patient or people who suffer from mental health illnesses, it's um, it's believed to like be a sign of weakness, or
Mm-hmm.
it's like shame. It will bring shame to the family. It's a disgrace to the family's reputation and face. So yeah, it is hard. It is very hard.
And what would you
Yeah.
like to see people
Yeah, I would
think?
love to
uh,
see that people change their view. I want to destigmatize this. I know like the younger generation, they are more open to
Mm-hmm.
talk about their mental health to others, but not to their parents, because
Oh,
between like the parent, children, relationship, there is still that how can I say, like how the parents immigrate to the US and they sacrifice everything
yeah.
for their kids. And in return, they do expect their kids to do well, excel in anything
Mm-hmm.
in life, in school. So
Mm-hmm.
the kids still have that pressure to do well. And, they cannot share that sometimes that pressure, can affect their mental health because they're expected to do well, because it's like, oh, I did so much for you, you should have to do well. So there is that, they can talk to their parents. But I know that the younger generation, they are more open to like seek help
Okay.
from others,
Yeah.
from their friends, even from providers.
Because it's in the schools now.
Exactly,
Yeah. So the
exactly.
dialogue is
Yeah,
changing.
yeah. So it's
Um,
slowly changing.
so that means like the shift is
Yeah,
coming, and then
yeah.
hopefully we're also bringing along, the elders as well,
Right.
right? And maybe they don't. Maybe it's not called mental health. Maybe it's called let's call your daughter.
Exactly. Yes,
Yeah.
yes,
And
yes.
who can
Right?
deny that?
Yeah,
We're just
exactly.
connecting people
Mm-hmm.
together
Yeah,
so
yeah.
that they can support one another. And maybe there's a way, for the different generations to find the common ground,
Yeah.
and keep
I
those
really hope
connections.
so. Yeah.
And you're part of that.
I am.
You get
I
to
am.
be you're on the
Yes.
trailblazing front of
Yes.
it. Like
Yes.
people are asking you for the
Exactly.
answers and you're giving them to them.
And I'm trying my best to help as much as I can and destigmatize this. And especially, I mainly see elderly patients. Like the
Okay.
majority is elderly patients. And when I talk to them, I want to let them know that it's okay to talk about it. It's okay to seek help, and it's okay to, like let your guard down, So that's actually my goal. Like when a patient leaves the clinic, I want them to feel like knowing that it's okay to be vulnerable, and that it takes a lot of strength, and it's a lot of takes a lot of courage to open up. But I want them to know that to know that it's not a shame to talk about it. Yeah.
And how do they react when you bring this to them usually, right?
They still are very hesitant. I mean, it
Guarded?
takes time. I'm
Yeah.
sure it won't happen from like one conversation, but
Yeah.
I'm trying to like one conversation at a time
Yeah.
to change it, because they do come back to see me,
Yeah.
and they do ask again and keep talking about it, and then the next time I see them, I can realize they are more open to talk about their mental health, and then once we have that connection,
Yeah, that makes sense.
they are more open to
Have to build the
express their
yeah.
feelings.
Wonderful.
Yeah.
If people wanted to get a hold of you or learn more about, the place where you work, where would they go online? Anywhere? Eh,
Yeah, so we do have a website. It's a Wynn Medical Center website, or they can just Google my name.
Okay.
And it will pop up too.
Okay,
So I'm
good.
on that website too.
So you're
Yeah,
connected. Good.
yeah,
So
yeah.
people can, because there might be other people that want to connect with you. So,
Yes,
yeah.
yeah. I'm always welcoming everyone with open arms. Yeah.
Beautiful. Well, thank you so much for the work that you're doing. I love hearing that like you are part of the solution. Like you are a change maker. You're somebody who's like right there doing the work person to person and coming up with solutions that are going to push this dialogue forward into the future. So thank you.
Thank you so much
And
for
thank you
having
for
me.
sharing your story and the story of your community and taking the time today. Really appreciate it.